My name is Justice Isaiah Ochola, Deputy County and STI Coordinator for Homa Bay County. I want to start by saying that this is my first time attending Mesa Cafe, and I've really benefited from this. It has provided me an opportunity to interact with you people, and I hope it is going to provide me with an avenue of at least advocacy to reach our people with HIV information. I want to start by saying that Homa Bay has been leading in terms of HIV prevalence from as early as 1990s. The reason being, according to me, I would attribute this to three things. One of them is historical. Historical in the sense that Homa Bay was among the first government facilities to start offering ART treatment, to start offering ARVs to the public. And as you remember, that time, the ARVs were very expensive. But Homa Bay, because of the support we got from a development partner, that was MSF, we started offering ARVs as early as 1999. This attracted very many HIV-infected people from other parts of the country. They were coming to Homa Bay to access treatment. And as you know, people interact. As they were coming for treatment, they were interacting with Homa Bay people. So this could be one of the reasons why HIV spread at that time, at that high rate in Homa Bay. Secondly, as you could remember, Homa Bay has got the longest beach among the 4 counties of Nyanza. This leads to, and you know, as the culture of the fishermen, they keep on migrating from one beach to another, and therefore they keep changing sexual partners along that line. And as you know, that's a risk factor in spreading HIV. The other thing is the Homa Bay is predominantly a Luo county, and as you know, naturally Luos traditionally have not been circumcising their males. So there was low prevalence of male circumcision, and as science has shown us, male circumcision has got a preventive benefit to the male when catching HIV. So these factors combined made Homa Bay have a problem in terms of HIV prevalence. However, as we speak here today, I'm glad to say that the Ministry of Health in the county government of Homa Bay has put in a lot of interventions which has started to bear fruit in terms of HIV prevention. One, I must appreciate the media and even the government for doing advocacy to the people on HIV prevention measures. One of them being starting people on treatment as soon as they are discovered that they are sick. This is test and treat. As you know, people who are started on treatment early have got a long-term benefit of lowering the viral load within their blood circulation, so they are not spreading the HIV. The next thing that has been done well is prevention of mother-to-child interventions. These are, women are encouraged to go for HIV test whenever they want to become pregnant. And if they are found to be HIV positive, they are started on drugs. These drugs makes it almost impossible for these women, if they take drugs correctly, it makes it almost impossible to pass the HIV to their unborn children. And also, we have put also in place measures to make sure that these women deliver in the hospital. Once they deliver in the hospital, even if they are HIV positive, chances of the blood from the mother getting into the fetal circulation is minimized. So hospital delivery has increased over time, and then also the advocacy. The advocacy, even males who are circumcised, if they don't know the HIV status of their partners, they are encouraged to use the use of condoms and use of safer sex among the population of Homa Bay. All these factors combined, I want to say, this has what has seen us drop the HIV prevalence from a high of 27% to currently 19.6%. And I would say this is an achievement, and we want to still continue striving to make sure that this figure even goes lower. By lowering the prevalence does not mean that we are saying that those people who are HIV positive die so that the prevalence goes down. No. We want to say, as much as they are taking their drugs, but the people who are coming into circulation do not catch HIV unnecessarily. So all these factors, we want to encourage our people not to default when they are started on treatment, so that we continue this success story of making sure that Homa Bay becomes HIV free, or we don't become #1 in terms of prevalence.
Thank you so much.
So
Yes.
now,